I hear Republicans are holding their 50th or 60th vote next year to repeal or undermine the Affordable Care Act. I've lost count at this point. But here's something easy to remember. If that bill ever actually reached my desk, I would happily veto it.
Let's all join hands and be calm. The topic is Obamacare. The issue is repeal. And we are once again at a point where one simple statement needs to be put out there, discussed, and understood by everybody. That and much more. Let's welcome back to Newsmax Deputy Health Editor, also co-author of the very popular Da Vinci's Baby Boomer Survival Guide, Live, Prosper, and Thrive in Your Retirement. Nick Tate joins us here in the studio. Mr. Tate, always a pleasure. We are calm. We're not standing this time around. Maybe we should, because we learned about standing next time. But let's say this out loud now. Obamacare will not be repealed. Okay? Understand, this is a fact. Yes, I'm not understating or overstating, correct?
As long as we have the president of the White House, who his name is basically on the bill saying he's going to veto any repeal legislation, that's true. But the Republicans have come up with an alternative.
Right.
That actually might have a chance of getting bipartisan support, and that would put the president in a more difficult spot, because this new law that was rolled out this week would in fact preserve some of the things about Obamacare that people really like. So it really is a potential compromise.
But okay, wait a minute, let's go a little deeper here. The Affordable Health Care Act is in effect at this moment. It is already in people's lives. It is already in insurance companies. It is already tentacled, if you will, into our existence. You cannot, please correct me if I'm wrong, you couldn't just repeal it. That would mean basically excising everything, exercising, if you will, everything out, pulling it out and starting again. You can't do that because of the fact it's there.
It's true. For 5 years it's been in place. But the truth is that this new law, which is called the CARE Act, it's actually got a much longer name, but the abbreviation is the CARE Act, preserves many of the aspects that are in Obamacare. So it's not a full repeal where you would rip out Obamacare and replace it with something else. It modifies some aspects of Obamacare. It would jettison some things in the law and replace them with other funding
Which
schemes.
need to be jettisoned and replaced. Absolutely.
This is the thing. Some of the aspects of this Republican CARE Act are actually things that people have been talking about for a long time that would be smart things to do. And we can talk about some of those details.
Very quickly, a couple of those details.
Sure. The law would jettison the individual mandate, the employer mandate. It would get rid of the Obamacare exchanges, although states would have the rights to keep them if they want them. It would change the subsidies, so middle-income folks would still get subsidies for buying their own insurance, but at lower levels. People with pre-existing conditions would still be able to get insurance. Insurance companies would not be able to bar them as long as they had continued insurance. And there's a series of other things that it would keep, like allowing parents to keep their kids on their health insurance up to the age of 26. Medicare is not touched at all, but there would be different funding mechanisms. Principally, you would pay a tax on a certain portion of your health benefits if you get employer-provided benefits. So I actually think some of the ideas in this law might actually gain some purchase with both Democrats as well as some of the folks in the White House. It remains to be seen.
Fix it, but okay, no repeal,
That's right.
but there are things that must go, absolutely.
That's
we get that, so get that out of the way. About 70 seconds that we have left here. Two things. End of the common cold in sight?
That's right. British researchers have identified what they think that they've kind of cracked the genetic code for the common cold. Now, this is bench research. It's early science, but they have found that there are ways that they can keep the virus from replicating and spreading and reproducing. If they can demonstrate that this technique this technique works outside the lab, and they can develop a drug that you could take that would actually make it happen, we could see a pill on the market. It's a while, it's a couple years, but it's a proof of theory, and it's certainly at least a little step forward, and it's nice to have in the middle of the cold and flu season.
All we have to do now is get certain people to take it.
Well, there's that too.
Here comes the next thing, last thing. If you're over 50, get tested for hepatitis C. Excuse me?
Well, Hep C, they have found 3/4 of cases of Hep C are in baby boomers. 3/4 of the baby boomers who have Hep C don't know they have it. Now, hepatitis C is the primary cause for liver transplants and liver cancer in this country. So if you're over 50, you have a better than average chance of having it. You can go to your doctor's office and a simple 20-minute test determine if you have been exposed, and then a treatment regimen has huge success in about a 3-month treatment. So CDC is recommending if you're over 50, get the test.
Thank you very much for scaring us all again. But it's not a really scary. It's simple. Take care of it. That's
right.
the good part about it.
Absolutely.
Okay. Reminder once again, the book, co-authored by Nick Tate, Da Vinci's Baby Boomer Survival Guide. Live, prosper, and thrive in your retirement. Get the book now by going to babyboomers711.com. All right. Mr. Tate, thank you very much for being here.
My pleasure.
The Friday water cooler bubble's over, and break out the gloves for the political punching bag. That's all coming up as the Friday edition of MidPoint continues right here.